Right, good morning, everyone. It is 10 o'clock, so I will start the meeting. Can I welcome everyone to this meeting of the Employment Committee? Can I also welcome Rosemary? Nice to see you back and safe. So nice to have you back in the camp. As usual, the meeting is being broadcast live on YouTube and is also available for viewing after the meeting. The link is available on the Council's website. Can I ask that all members and officers have their microphones on mute until they wish or are invited to speak, and that officers show their camera only when presenting reports and answering questions. So we have Andrea online this morning. So good morning, Andrea. I have received apologies from Mrs. Broadley and also Mr. Harrison Rushton this morning, and we have no substitutes for those two members. So firstly, item 1, we need to confirm the minutes of the meeting held on the 17th of November 2022. These are on pages 3 to 8 of your agenda pack. Okay, thank you, Dan. I'll move those and sign those. I'll sign those later. All in favour? Yeah. Right, weren't here. Okay. Item 2, question time. I have received no questions from members of the public. Item 3 on the agenda, questions asked by members under Standing Orders 7.3 and 7.5. I've received no questions from members today. Item 4, to advise of any other items which the Chairman has decided to take as urgent elsewhere on the agenda. I've not been notified of any urgent items today. Item 5, declarations of interests in respect of items on the agenda. Do any members have any interests in respect?
I just wonder whether you and I, Chairman, need to declare being on the EMSS Joint Committee. Maybe we don't need to declare that, and I'll take advice on that.
Okay. Okay, yeah.
Well, there you go.
That's good advice. Thank you. Yeah, we've been advised. So yeah, thank you, Richard. Yeah, we'll note those. So.
There you go.
No others. So item 6, presentations of petitions under Standing Order 35. There are no petitions today. Item 7, which is our first report on the Chief Executive's Pay Award, pages 9 and 10 in the agenda. Sarah Short, the HR Services Manager, will present the report, and Gordon McFarlane, Assistant Director for Corporate Resources, is also here, and he'll give us a verbal update on this year's pay negotiations. Sarah.
Thank you, Chairman. It's a very short introduction because it's a very short report, to be honest. So the purpose of the report is to seek approval from Employment Committee for implementation of the 2022-23 Pay Award for Chief Executives. This pay award is in line with the National Joint Council Award and also the JNC Award for Chief Officers, which was reported to committee in November. So the award is actually a £1,925 increase. So the committee are asked to approve the implementation of the 2022-23 pay award for chief executives. And as you said in your introduction, I shall hand over to Gordon for an update on this year's pay claims, which we've received this week.
First. Do members have any questions on the report in the agenda pack? No, I think we're all aware of it having been approved. So no, carry on, Gordon.
Okay, thank you. I just thought I'd do a quick verbal update on the 23-24 pay negotiations. Staff side submitted their claim about 2 days ago, hence the verbal update. And what the staff side nationally are looking for, and this has probably been quite well publicised even in the last couple of days, is RPI plus 2%, and they're basing RPI as at November 22, which was 10.7%. So effectively looking for a 12.7% increase. That's the starting point. There is a lot of narrative in their claim around the last 10, 12 years, how local government pay has fallen behind, etc. It's a well thought out claim, but again, it's a very, very high, in my view, unaffordable starting point. And they're also looking at driving the minimum rate up to £15 an hour within 2 years. And then there's a number of other claims which we've seen before in terms of family leave and associated pay, improving those conditions, and another additional day of annual leave, because there was one this year for personal well-being purposes, a home working allowance for staff where it's a requirement to work from home, not where it's optional. They've put in a request for the reduction of the working week by 2 hours. Again, we've seen that before. And then looking at a review of the pay spy and including the top end, and thinking about sort of particularly retention. So there's a recognition that the problems aren't just in the lower grades. So we know that the national living wage has become a key driver. It's currently £9.50. It increases to £10.42 from this April. That's a 9.7% increase. So some of this is driven by the national living wage increases and predictions for the future. And government policy is still for national living wage to reach 66% of median earnings next year. And these are all projections. And nobody really knows, but the Low Pay Commission projections are that could result in a national living wage of £11.35 by April 24. So I know I'm jumping ahead to the following year, but certainly in terms of where the staff side will come from and what the employers need to be cognizant of, that's a potential as well. So what are the steps that we would take? Will it be a 1-year deal, a 2-year deal, etc.? And I think there's a real challenge for the employers and for us in local government around the financial impact of a pay settlement. And we've put 5% in the budget, it's 5% in the MTFS, versus addressing the cost of living. We know that in terms of, we've talked about this before, in terms of recruitment and retention, we've got severe challenges, some of which are driven by the cost of living crisis. So there's a number of regional briefings starting next week, and we'll certainly update Employment Committee informally, because I think this will run for a while, informally about the employer response to the trade union claim and any information that we glean around tactics, possible models, considerations. Will it be a percentage increase, a flat rate? Will it be bottom loaded? There are lots of options to consider. And the only other pay claim we've had so far is the chief exec's body pay claim, the main element of which is to tie the increase into the same percentage increase effectively as the top of the National Joint Council. So the one I've just described. So wherever that gets to, they're kind of saying shadow that. So that's probably, there's a detailed document, but that's probably all I need to pull out at this point. And happy to take any questions.
Okay, Richard.
Thank you, Chairman. Are there any wisps as to whether the employers are minded once again to offer a flat sum to all grades?
I'm hoping we get an indication of that at the regional briefings, which start next week, because they should, the confidential briefings, and we should be able to have those open conversations about not necessarily negotiating tactics, but where we might be heading in terms of whether this is a flat rate, or as I say, percentage increases, or bottom loading with a percentage increase. So it's there are options, some of which will be more or less palatable, and some of which might cause some problems at the lowest end of the scales, which we've seen this before, and we've had to make adjustments when the bottom few grades get crushed together. So you find that supervisors are paid very, very, little, if at all, more than the people that they're supervising, just as an example. So lots to consider.
Can I just clarify, you said about part of the negotiations was about working from home being, did you say built into a sort of contracts? At the moment, a contract of employment is obviously for a place of work. So was that what you just clarify that point?
Yeah, it says a home working allowance for staff for whom it is a requirement to work from home.
Okay.
So, for example, we haven't got any, but if we picked a service and said that service could work full time from home, and the contractual base becomes home rather than contractual base being a workplace. As I say, we don't have any of those, but I've worked in authorities that have done for a number of years. So what they're saying is, in those circumstances, is there a home working allowance? That's what they're pushing for.
All right, thank you, Peter.
Just to come in on that as the lead member for the ways of working side, we obviously have a hybrid way of working here, and certainly it's my preference not to have any employees that are permanently based at home, because I think having that kind of mixed approach where you've got the collaborative working at offices in county or campuses or other campuses is the right thing. So I certainly wouldn't support having employees based permanently at home.
Okay, thanks, Peter. Okay, if there's no other questions, we're asked to approve the implementation of the 22-23 pay award for chief executives. Does everyone agree? All in favour? Yes, thank you. Okay. Item 8 is our next report on the gender pay gap, which is on pages 11 to 18 of the agenda pack. Sarah, again, I think you're going to present this report. Thank you.
Thank you, Chairman. This report is to provide the committee with the results of the gender pay gap for 2022 prior to publishing on gov.uk. The gender pay gap reporting is a statutory requirement under the Equality Act, and the results cover the period from the 1st of April 21 to the 31st of March 2022, and we're required to republish the result by the 30th of March 2023. I always have to think very carefully about my dates. The results this time show a slight increase in the gender pay gap for both the mean, so that's gone up from 10% last year to 11%, sorry, 10% in 2021 to 11% in 2022. And similarly, the median pay gap has increased to 8% as opposed to 6%. And I've had to do a little bit of diving into some of the data that sits behind this to try and establish what the reasons are. And I think there's probably two main issues. One, and I'll come back to this in a little while, is the proportion of women that we have in the lower quartile. And then also what we saw in 2022 was the payment of a regular retention payment to HGV drivers in waste and highways. And also we saw some regular retention payments being made to waste operatives also in environment and transport. So I think it's those two things that may have contributed to the slight increase this time round. There is a further point to note in relation to the gender pay gap in terms of the reporting period for 2022. So the rules around reporting on the gender pay gap in terms of what we have to include and what we have to exclude are very prescriptive. And one of the things that we've had to exclude but then report separately is a payment that was made to employees in adult social care, particularly in the reablement service, on the 31st of March last year, which was in relation to some monies that we received from the Department of Housing and Levelling Up to support adult social care on the back of the pandemic. So that payment, which went to predominantly female staff, we've had to treat separately for the basis of the gender pay gap. So I think if you were to take those two things together and to put that figure back into our normal gender pay gap reporting, we would end up there or thereabouts as to where we were the previous year. I think that covers the fact that we've had to separate out this retention payment, and it interestingly means that we have a positive gender pay gap in that area in terms of the median of 81% and 1% in terms of the mean. When we've looked at, and there's very little comparative data that's been published so far this year from other local authorities. Sometimes when we report to committee, we're lucky and we've got a lot of comparative data that we can use. This time around, the only local authorities that were kind of comparative to us in terms of size were Lincolnshire County Council and Newcastle City Council. And again, that data shows that Leicestershire does have a higher pay gap than those two authorities. But then again, if you look at the percentage of women in that lower lower quartile, there's a higher proportion of female employees that we have in that lower quartile than those other two local authorities. So again, I think that explains where we are. And what I don't know is whether the services that we have in-house, such as school food and the home care service, whether those are actually in-house in those two authorities. So again, that can have an impact on making that comparison. What we are trying to do at Leicestershire is to continue to support our workforce in a number of ways. And you will see in the report that we've reported on the number of employees who are participating in our Springboard and Spring Forward programmes. But also this year, we've in 2022, we launched the Aspiring Managers programme and also developing effective leadership programmes in children's services. And again, those two programmes encouragingly show a very high proportion of female participants. And then finally to note was that in September 2022, Leicestershire County Council received 2 awards at the Menopause Friendly Awards, one for the Best Training Initiative and won a community award for one of our learning and development advisors, Mandy Borghurst. And also, as in the introduction to those awards, we also received very positive feedback on our supporting employees through the menopause in the workplace policy. So there's a lot of really good stuff that's happening. I'm hoping that when we start to look at the data for 2023, that we'll actually pull off in a couple of months' time, once we've got that we will see that actually we are going to start to turn a corner, particularly because we won't have some of these payments that may have skewed the results slightly for this year. So the recommendation for the committee is to note the content of the report and support the publication of the gender pay gap by the 30th of March 2023.
Okay, thank you, Sarah. Barry.
Thank you, Chair. A few questions just to drill down on this a little bit. Okay, I understand what you're saying about what has had an effect. So we've had a small increase over this, but obviously when you look at this and you look at 2019, 20, 21, 22, it's pretty consistent all the way through. We're double probably what Lincoln are doing, etc. as you go through that. And obviously what we've got to try and understand is why that's the case. And we can look at it and say, well, there's more females in a certain quartile, so doing that. But if that's fine, if that gives us the reason why, but then you have to ask the question, why have we got more females in that lower quartile than other councils have? I think it's interesting that you've pulled up the figures of the other two councils to give us an idea. And I think going forward, it would be useful to pick one or two and really look into what is the difference, what's causing that. I mean, when you look historically, there are probably 3 things that probably affect females more than they do males. Obviously, in their younger years, pregnancy, raising a family, people often feel like their careers might go on hold. They don't get the opportunities to move forward. Training and how much people take that up. And also it comes down to, there's a difference between male and females. Males are more assertive. They're more inclined to push themselves forward, to push themselves, take on opportunities, etc. So it's making sure that we're encouraging people to come forward more. And then finally, as people get older, as you say, with this menopause thing, and that is probably only in the last year or so that's really started to come through into the press, and there's programs about it, but it's been affecting people for generations. And it's great to see that it's now coming to the forefront. And as I say, when you get to my age, you start to appreciate this more because you have people around you that are suffering from this, and you start to see that the impacts, it's tiredness, it's lack of concentration, it's things that and people I've spoken with personally tell me how all of a sudden everything changes in your world. And it's really important. It's great that we've got these awards, but it's really important what we're actually doing in the workplace to make sure that we really understand what these things are. I see it on a lot of committees and I see a lot of things. It's almost like a diatribe. Yeah, we're doing this, we're doing, but it's what we're really actually doing, really understanding the issues. And I wondered with this, I mean, are we talking to our staff and getting feedback and understanding exactly how it's impacting them and what we can do to help around that to keep people up? And I suppose I'm just have the concerns that you just see this year after year after year, we're still the same figures. And although we might be tweaking around the edges because we say this has affected us this year or that year, it's getting those figures down to, as you see with say Lincoln, which in many of their quartiles is similar sort of numbers. I just kind of like to understand more how that comes together.
You might.
John?
It's on there.
Yeah, brilliant. Apologies. If I take those in reverse order, if that's okay. So I think in terms of the programme of work that we are doing in terms of awareness around the menopause, we run regular training sessions for all employees, but also for managers who are maybe managing employees who are going through the menopause and understanding the symptoms and the impact that that can have on the workplace. So that is something that happens on a there's a programme of training that takes place. That I think there are probably monthly sessions that are run across the organisation, and if it would help in terms of the committee, in terms of the numbers of people who are attending those, we can provide that for you if you would find that helpful. And I think one of the things that we have done, and this leads to the award that Mandy, who's the Learning and Development Advisor, won, is that championing of these issues in the workplace and making that very, very visible. And that is something that I think, and Gordon might want to come in on this as well, I think it is something that actually as an organisation we have done over a number of years, and that is starting to have an impact. I think in terms of the ability for the female members of the workforce to be able to progress, I think in terms of the Spring Forward and the Springboard programmes, that's exactly what those programmes are there for. And again, I think the high participation rates now in some of the other management programmes, particularly the Aspiring Managers programme, is really, really encouraging. What we won't see in the figures that I've reported today is the impact of that and those sort of tracking those people to see whether they have then gone on into supervisory positions within the organisation. And that's, again, something that we need to think about going forward, is how we measure that and the effectiveness of those programmes. And then in terms of the actual numbers, I know exactly what you're saying, because when we pull them off and we start looking at them, I think every year thinking, oh, this is going to be the year where we see a difference. And I think there are reasons when you look at the statistics and the number of employees we have, and we could go, we could speak for half an hour about the quality of the information that we have, but there is an issue about the numbers of people, and that's why the mean and the median are quite interesting versus the kind of the percentages of people in those quartiles. So I do treat the comparative information with a degree of caution. I think what you're saying in terms of actually understanding what service those other councils have, I think is a really valid one. And I think we need to do that so that we are comparing similar organisations. The difficulty we have every year is that because the publication date is the 30th of March, the only comparative data we can use is what other organisations have published to date. So we could go back a year and view what they published last year and compare that. And that's where the timing gets a little bit tricky, because obviously we have to report by the 30th of March as well. But it's something that we can definitely think about for other years and have conversations certainly with Lincolnshire and Newcastle to see what they have done and bring that back.
Back, Chair. So when you're comparing data, but do we actually have conversations with those with our councils at the moment, or is it just getting the data?
with the information that you've had reported today, that was purely getting the data.
So I think the conversations is the important thing, because then you can dig down into it and start to understand things more. Yeah, for sure.
Thank you.
Gordon, just wanted to come in.
Yeah, just a couple of really brief bits to add to Sarah's points. I think I completely agree around the menopause work. The awards are great, but there's a lot of hard work, a lot of education, awareness, socialising the issues that has happened. And I think, yeah, accolades are fine, but it really is those are based on the really hard work that's been done. And I think we've got really good traction and we get great feedback as well. I think in terms of how we shift the figures, we've obviously given some examples of what we're doing, you know, the culture of the organisation, some of the internal development we do. I just think when we start to look at the 22-23 figures, we have to bear in mind some of our real practical difficulties in terms of recruitment and retention. And it's kind of balancing pay, going back to that, versus this is a great organisation to work for and a great organisation to develop in, etc. I think we might see some shifts. I don't know what those shifts are yet, because they are affecting lots of grades, not just our lowest grades, but we might see some shifts. We know that our turnover is higher than it's been. And I just think it's something to watch and try and understand in terms of what this year's figures that we report on next year will be. I'm doing your trick now. Yeah, so just something to bear in mind. I think there'll be maybe a wider conversation.
Okay, thanks, Gordon.
One final thing, and I think it refers back to what we were just saying on the previous report. When you're saying like supervisors' pay can be just a small fraction, that's the first stepping stone to moving up the ladder. And I know in a lot of places when I've spoken with people where they work in a very similar situation, I know if why don't you run up the ladder and you say, well, I'm going to get 10p an hour more if I do it. So people just don't do it. So if we're looking at that, then this lower quartile figure where we are higher than most people is probably where that starts off. And that little comment that we had in the last report was saying that's compressing, it's actually probably quite an important stepping stone to moving up.
Could I just come back to that really briefly? And I think, again, it's kind of helpful talking about the two things at the same time, because I think when we're monitoring what's happening in the national negotiations and trying to feed in at a regional level, if we're starting to get a feeling that the settlement or the potential solutions are going to create that challenge, we really need to push from an employer's perspective and say, there's a wider conversation here. We have to avoid that, not at any cost, but we have to avoid that, because here's what's going to happen on the ground. Yeah.
I've got Peter and then I'll take Dan. Okay, thank you.
Thank you, Chair. Just a couple of points. I mean, the report obviously has a lot of data, a lot of statistics in there. So there's, you know, tendency to maybe get a bit lost in all the different means, averages and so forth. Data always comes with a bit of a warning around that. In terms of, I mean, some of the kind of reasons that you kind of articulated around, I think Barry mentioned as well, you know, around people going off maternity leave, taking maybe career breaks to raise children, etc. These are all stuff that's historically happened since time began, you know, in terms of the working environment. I'd just be interested to see how you connect all the dots with our employee surveys. And we have quite an extensive employee survey that goes out in terms of career progression, you know, culture, work environment, to ensure that actually all this stuff's tied up, you know, it's all linked together. You know, if maybe women might feel a particular way about a particular issue or particular working practice, and therefore haven't decided to go for a more senior position. So I'd be interested to see or hear your views on that.
I think that's a really valid point in actual fact, because I think the May we will be conducting a new staff survey in May. We will be reporting on that to this committee probably in September. So I think that's definitely something that we can do some kind of analysis of once we've got the results of that staff survey, just to see whether there is a correlation there.
Dan.
First of all, I'd like to thank Sarah for her fantastic introduction to the whole programme, and it was very, very revealing. And I think that the battle's going to be, which is going to distort things, because obviously you highlighted two areas where who are paying more to attract people in. And I just feel now maybe you've got to try to, I don't know how you can extrapolate and put things and not build it in because it's not normal. That's something where we've had to buy to get the specialist skill, whatever level it is at. But that's the marketplace. And if we're in the marketplace, we've got to have, there will be anomalies, but it's how you're going to present the anomalies towards, which you did very well, and I was able to pick up on it. But when it's all in those figures, it obviously creates a level. But obviously, when we're actually spending more money to purchase better skills, because all of a sudden the market is there, and as it's moving forward, that will happen to us. So, you know, where we had stayed levels for many years, but I think it's much more volatile now. So you need to think how we can express that in some of this framework that you're putting together, which is excellent, but we really did need your explanation of it. And that was wonderful. Thank you.
Thank you very much. All I would say is that I think it's actually getting that sort of looking at that granular level of detail, and some of it is quite nuanced, as you've said. I think going forward, we just need to keep an eye on it. Every 3 years, we're also required to do an equal pay audit, which the next one will be, I think it's next year in 2024. Yeah, it will be. We did one in 2021, so it will be interesting to see where that takes us, because that covers all elements of pay. So we're not having to do this exercise where we are artificially taking out some elements and then putting them back in. So that will, I think that will give us a really good understanding of that baseline information at that point.
Okay, thank you, Sarah. Thanks for some good questions. I mean, it's interesting. I think paragraphs 12 to 16. It's the good work that we're now doing. I think it's good to read those. It's good that you know, the training that we've got, the Aspiring Manager Programme, is well attended, and obviously that's helping the gender pay gap issue. I think it's interesting on benchmarking. It's good we understand the reasons, but I think benchmarking is so difficult. I mean, you wouldn't really look at Leicestershire County Council and think that we compare with Newcastle City Council as the, you know, the right one to measure your data off. I think benchmarking is such a difficult thing to do. But I mean, obviously you have officers, presumably conferences, like for like peer reviews and peer meetings to sort of, yeah, best practice. So it's I think the points are well noted. So. Okay, we're asked to note the content of the report and support the publication of the gender pay gap by 30th of March 2023. Members happy? Thank you. Thank you, Sarah. Item 9 on the agenda is the report on attendance management on pages 19 to 24. Andrea is, as I say, online, and she's going to take us through this as our HR business partner. So, Andrea, over to yourself. Thank you.
Good morning. Sorry. Good morning, everybody. So the purpose of this report is to go through the absence position at the end of Q2. The Employment Committee had the last report on the 17th of November, which was the position at the end of June. Sorry, let me just move my screen. That's the table at the bottom of the first page of the report shows the previous 6 years plus the position at the end of Q2 and Q1, with the FTE totals and the total costs for the positions and the LCC total. The chief executives and public health departments were below the corporate target of 7.5 days, and the LCC total was at 9.45 days. There's still obviously a lot of attendance management work still to do across the council for us to achieve that work, and that work is still ongoing. Reasons for absence continues at point 9, and the new Q2 is added onto the end of that table. As we can see, stress, mental health, depression, which we've talked about previously, continues to be our main reason for lost time, currently at 27.3% of our lost time. COVID COVID-19 and other musculoskeletal are our other top 3 reasons for lost absence, and the rest of the reasons in that top 10 continue to be similar. In terms of our not disclosed absence, CMT asked us to look at communications to try to reduce that not disclosed absence. I believe we talked about that last time as well. So we are making communications to those areas to try and reduce that. So over a period of time, we're going to try to make efforts to improve the recording of absences without reasons for absence. And that's starting to come down. Across the page, previously, the committee asked for some comparator information. This is at the end of March 22 for other similar authorities, and our council is in bold in the middle of the page at 9.91 as it was at that position, and the top 3 reasons for absence are also included in this table as a comparison. In terms of the presentation of where we sit in that table, you'll be able to see that, and obviously the reasons. So when I've finished the report, we can come back to any questions about that. Over the page, the long and short term split, we've again shown for the end of September position. Again, this shows a usual balance of the majority of the time lost being to long-term sickness, and it being around the kind of 45 to 55 split is generally the area that it looks around. And then onto the service level data, which looks at a more granular level in departments in terms of what the trends are at each of department levels. And there are just some adjustments in terms of where some of the structures have changed. That is all of the information from the attendance management report. If there are any questions or anything further that Gordon wants to add to the report before questions.
No, Gordon's indicating he's got nothing to add, so I'll open it up for members. I'll go for Richard and then Dan, if I may. Thank you.
Thank you, Chairman. I began feeling a bit grumpy about this, but maybe my grumpiness isn't quite justified. I've been on the committee for a long time now, and we always seem to be discussing this. I was saying to myself, well, what difference have we really made? Now, I can see, looking at the figures, there are differences over the past 6-7 years. That is there. It is there. And yet, the cost to the authority and the number of days lost are still, would all I think say, unreasonably high. Maybe just the way that my head works, brain works, but I'd like to see a trend line graph over the past 10, 15, 20 years, and how we can go back. If people think that's a waste of officer time, then tell me and I'll withdraw my suggestion. It just might rather starkly bring home to us all, I think, the degree of changes that have been. I know the way you can present these trend line graphs is variable. You can make the change look big or small, can't you? I know that, the way the proportions you use. Just a suggestion. But certainly looking back more than the current 6-7 years would be interesting to me, I think. Yes, there have been changes, and yet, only 2 departments are below the target of 7.25. I can't remember now why we fixed on that particular target, but clearly we're not achieving it very well. So without sort of all of us beating ourselves up, I just say to myself, we get these reports regularly, plenty of data there. Yes, there are changes happening in departments. I can see that. I would like to know what the long-term trend over more than 6-7 years is, and ask myself, without going into laborious detail this morning, what else is there that can be done on attendance management?
Andrea, anything you want to add to that, or are you happy to present a chart, say, going back 10, 12 years, just to sort of satisfy what Mr. Shepherd was asking for? Gordon?
Thank you, Chair. Yeah, I will go back into all the data that we have logged, and I'll go back as far as I can. We have data for. I think that's a perfectly reasonable request, and I'll produce that for the next committee.
Okay, thank you.
Yeah.
Okay, Gordon.
Yeah, it was just a couple of things to add. I mean, absolutely right. This has been a standing item for as long as I've been here, and that's 10 years. And you can argue what progress have we made, and I think we'll go back and provide as many figures as we can, and we don't want to make an industry out of it, but I think context is also important. So when we look at whatever the line looks like, and I think we know what it looks like, context year on year, in terms of, you know, even some of the recent things, COVID, recruitment and retention challenges, cost of living challenges, those are negatives potentially. Positive impact around ways of working and people be able to work remotely. Work remotely when they're perhaps not well. Some of the reasons for mental health, stress, depression, and all that set against all the good things that we're trying to do. I think what you'll have seen over the years in the committee is we've had lots of initiatives. We tried to do lots of good things, and we had a peer review, colleagues in North Yorkshire who peer reviewed what we were doing, because their figures at that point were quite low, and there was some different reasons for that. And that peer review certainly came back saying we were doing lots of good stuff. We certainly weren't doing anything wrong. We weren't missing anything. The bottom line for me, and Andrea will probably echo this, is it's keeping the foot on the pedal. It is just hard work. It is ensuring that managers manage cases. And okay, we can take it from a departmental and corporate perspective, and we can look at trends, etc. We can look at the broad reasons and understand them and try and put preventative measures in. But it is just hard work. So I just want to acknowledge the frustration, and hopefully without sounding defensive about it all.
Okay, thanks.
Yeah. I've forgotten, so could you remind me? I've forgotten why we had a 7.5 days corporate target. I mean, clearly must be a reason for that figure.
I think the 7.5 days was in place when I started, so I'm not sure what the conversation was around it. It was possibly looking at comparators at the time, and what was you know, if we were at 7.5 now, we'd want to get below that. So it's a kind of, yes, it's a point, it's a reasonable target. And we've never had reason to change it, because we should always be striving to get to that and then below that. So I'm not sure what the original conversations were, but it may have been comparators.
I think I remember when I started work, there was always an expectation that over the working year, most employees would take 2 weeks or 10 days of time off. So whether it's a percentage based on that was years ago, but that was a few years ago. So, okay, Dan.
Yeah. The stats that I find quite important that jump out is over 5 million cost.
Yeah.
That's really has an impact on me when I think how we're managing budgets at the moment, and we're trying to say, well, you can't have 50,000 or 100,000 for this. I mean, it is a big number to look at. The other thing is that 27%, if you just look down the list, to back and neck, which was always the problem, back problems, 3.9%. So there's a massive leap forward with stress and mental health. Now, the obvious question for me, Gordon, it'd be simply, is this because people are spending more time at home on their own? I don't know all the hours they're at home and back, but I know that there is a mixture of work. And there's got to be a reason in all of this. With the bad backs, health and safety became more involved, and you sit in a correct chair and you can't bend, you can't lift this or do anything. So there's lots of things brought in, and obviously, evidently, it's worked. But there's another problem now that is so hard to wrestle and deal with. It is mental health. I mean, how do you sort of deal with that, and you know, the implications of it, and COVID hangover from that? There's elements, and I understand all of that, but I think these are real solid figures that jump out. There's a big cost and there's a big number, and it's in one team area of our responsibility. We owe it as an employer to try to seek out and search this out to make sure that we're doing the very best we can for our staff that we employ for their health and welfare. Thank you, Mr. Chairman.
To try and just pick up those points, I think I start with the back and neck and also musculoskeletal. I think you're absolutely right. I think the health and safety regime, the risk assessment process that we've put in place over the last few years has vastly reduced that level of risk. For people who are either lifting and handling, or they're working on the roads, or whatever it may be, or as you say, people who are, driving a computer. So that's that side of it. I think in terms of the overall cost, some of that is a productivity cost because we don't always replace people when they're off sick. It's, mix between short term and long term. Some of it will be a direct replacement cost where we're running frontline services and we have to have people on the ground, so we have to get agency workers in very quickly. So there is a mix of productivity and actual cost, but it's a real cost, and that's the reason that we put that in there, because we need to focus on that. And for every day that we drive down, it reduces the cost proportionately. I think in terms of mental health, stress, depression, there's a couple of things. I'm not linking that to COVID or to working remotely, because if I go back a few years, and this is kind of Mr. Shepherd's point, if I go back a few years in terms of the trends, whatever our sickness levels have been, we've always been around 25 to 30% of mental health, stress, depression. Of our sickness absence being mental health, stress and depression. I think there is something around the pressures that people are under, whether those are personal pressures, whether those are work pressures, a combination. But there's also a key point from me that I think over the last few years, and you see this in the media and in the news, we're talking about it a lot more. There is a lot less stigma. So I think I can't prove it, but if we went back a number of years, people would have classed their sickness absence as something else because they didn't want to tell the organisation that they were stressed or depressed, or that they had a mental health problem or challenge. And I think that stigma is changing. Interestingly, I had a conversation with an external colleague the other day to say people are more willing to tell us about that, but there is a real stigma around cost of living and not being able to afford to heat or eat, and impact on their job and telling their employer. So that there are different stigmas that kick in at different points. The flip side of it is we're doing an awful lot of work around well-being and preventative work around good mental health, but also we're training managers about how to manage and support colleagues who are struggling with their own mental health, and whether they be maybe managers, how they're coping with their own mental health. We obviously have an in-house counselling service, and I could list a whole range of things that we're doing, but that's possibly for another day and another report. But the only other point I'd make is that we haven't got figures on for the reasons for the other counties, the comparator counties, but largely, not exclusively, but largely, their greatest challenge is however they classify it: stress, depression, mental health, anxiety related, etc. It's up there, and I've seen the figures in the past around 25 to 30%.
Okay, thank you. I've got Peter, and then I'll come to you, Barry. Okay.
Thank you, Chair. Just a few points, really. The table you include on the comparators, I think you've got Kent. That's obviously the best in that table. I just wondered if, similar to Barry's point around the gender pay gap, whether we have conversations to other authorities around what they're doing in terms of their strategies to reduce sickness leave. I think the private sector's average is about 5.5 days. So to see us at 9.5 is quite high. So it'd be good to know how that's feeding into a strategy to kind of drive that down. Secondly, just to remind me in terms of our policy on sick pay and sick leave, a couple of members mentioned the cost, or the kind of sunk cost to do with sick leave. What's our policy around sick leave? Do we pay full pay for a certain amount of time and then statutory sick pay? If someone had repeated instances of short-term sick, a couple of days here and there, are they continually paid their normal salaried amount, or is there a policy that kind of reflects statutory sick pay? So just a few points from me.
Yeah, if I just pick these up, and then Andrea, if there's anything you want to add. I think in terms of comparators, yes, we do talk to other authorities, you know, to try and keep these networks close, and do talk to other authorities about what they're doing. I think the only point I'd make around these figures is that if we looked, again, there's a bit of a trend here over the last few years. I think the majority of these have gone up. They went down COVID and they've gone back up again. And some of them, I mean, what's happening in Cumbria, I dread to think, but we've certainly seen the same sort of pattern over the last 3-4 years. In terms of sick pay, it's a national condition of service, 6 months full and 6 months half pay after a qualifying period. It goes from 1 and 1 up to 6 and 6. So the majority of our staff will be on 6 months full, 6 months half pay. The only other point, and Sarah was just reminding me, is some of the reasons for the problems at the moment are how, and again, we all know this, how stretched the NHS is. So people getting access to the NHS, us getting access to, doctors' reports, consultants' reports to help manage cases. We're seeing delays in those. I think it's inevitable, it's frustrating, but we obviously need good evidence to progress cases, so that if we're getting some delays, systemic delays, as you'll appreciate. Is there anything you want to add, Andrea?
No, I think just to echo the point about the NHS delays, I think that what we're seeing in absence management casework is a reasonably large trend of individuals within our workforce who are having to wait very long periods, sometimes up to a year, to see a consultant. Medical procedures are taking a huge amount of time, waiting lists. I don't know if any of you personally have got experience of this in your families where they're on NHS waiting lists, but we have, look at the size of our workforce. You can imagine we've got many people that are waiting on waiting lists, trying to get consultant letters, etc., are slowing down much of our processes in terms of trying to manage attendance. So in terms of the NHS situation, it is causing us issues in our attendance management processes, but also for individuals, it's causing them individual stress in terms of and we do actually have people who are off due to the stress of not being able to get through the NHS system. That is a factor. So I don't think that can go unnoted to committee, that hopefully that we will start to see these delays start to come down over the next 12 to 18 months. But it is a significant factor that we are seeing over a large number of people in our workforce. Thank you.
Okay, thank you. Barry.
Thank you, Chair. I suppose when you look at paragraph 9, you look at this table, there's 11 items on there, and I'd say 4 of those is something that we can have an impact on, in that stress, depression, mental health, other musculoskeletal problems, back and neck, and to some extent eye as well, because obviously we're using monitors. So of all that 11, I see 4 of those where we could have an impact on people's health in those issues. We can't control people catching viruses, etc., etc. Now, when I look at the figures, and I think what was suggested earlier about having a look at a trend over a longer period would be very useful, because the other musculoskeletal and the back and throat, back and neck does appear to be dropping, and I think we take on board what was said earlier with health and safety, etc. And we've all seen this. I mean, I've been in private industry for 40 years, and you've all seen people start to get funny shaped chairs and things like that to help them. So I can see how we can improve. On the stress and depression, obviously, we've got to look and see, you've got to break that down into what of that is down to us in the workplace, what of that is down into private issues. But even then, in the private issues, what are we then doing? And it sounds like we are working towards how we help people, because when people have got problems like this, and they come to work, and if work doesn't understand what they're going through, that then increases the stress on those people. In some ways, work is, if it's a safe environment where it's friendly and understanding, it can actually help in other matters. So I think that's quite important. From things that you've said in relation to other people's, I think that's sort of somewhere where we're going. On the public versus private, I think that's quite important. There are two figures, but with 40 years in private and 8 years in public, the real difference is in private it's a lot more cutthroat, and the way that businesses, and it varies greatly, but the way that businesses deal with people, especially with mental health and stress problems, is very different. And over those years, when I look back, I know of people I can think of now that were probably drummed out of private because of how they were. I would have thought that we're an understanding employer, and as a result, people are retained and people are kept, and it's how we help them through that. And in the private, and I've had to step in before, where I've seen someone being pushed out of a company, I've had to step in because I've seen it's because of OCD, etc. They're not performing, so let's just get rid of them because there's a problem. Whereas I would like to think we don't do that. I'd like to think we step in, we say, right, how can we help you with that and get you back onto level pegging again? So I think it's important when you look at the figures and you break them down and you do the comparisons, but it is looking at the things that we can have an impact on, because there's an awful lot of these things we can't do really anything with, but there's other stuff in there. And if we were to drill down on this stress, depression, mental health, which is the biggest thing, and the figures, the 400 million, etc., is the issue, how much we're paying. But if we could drill down on one of these things and look, because it looks like we have done on the back and neck, etc., it looks like we're making improvements. So it's that top one that we really need to look at. Thanks.
Gordon? Yeah, just briefly, I think we've done some analysis before, and I think Andrew was involved in a bit of a survey around trying to understand whether stress, for example, and associated mental health problems, etc., were work-related, were personal, or a mix of both. And I think you have to get to conversations about individual cases, obviously, but I think the trend, and Andrew, you can come in after this, was that it was a real mix, and sometimes one affects the other. For me, it's then the relationship between the manager and the employee, and able to have what some people might class as difficult conversations, which if we support properly should just be conversations. Yes, they may be sensitive, but they should be conversations. In terms of public versus private, absolutely, we have effectively 6 months, full 6 months, half that is an insurance scheme for somebody. The trick is that we manage cases and we don't just sit and wait for somebody to go into half pay, etc. And we haven't produced figures for quite a while, but certainly my recollection of a list of the number of people who were on half pay because they've gone over the 6 months is very, very small. So although we have a mix of long-term and short-term sick, we have very, very few numbers, and some of those may be, cancer related, for example, who actually are getting in beyond 6 months and are being actively managed. We might have a slight increase in that with what we just talked about with, the systemic challenges. Andrew, is there anything you want to add?
No, in terms of the survey, yeah, that's exactly it. I think when we got into the detail of specific cases, I think the majority of the cases that we had information back from people on was a real combination of people saying actually they were having demand at work, and then they were having demand in their own life. There were a lot of cases that were related to bereavement, and as a result of that, we've actually developed some specific bereavement support, and the wellbeing advisors have actually been developed some wellbeing group support, which has been really positive. So we've got some specific training for managers and for colleagues around bereavement to help them with people that work for them and work with them that might be experiencing bereavement, but also for these groups to meet and be facilitated by a wellbeing advisor, because bereavement, as we know, is not just an event that happens and it's dealt with straight away. It can affect people's mental health for a long period of time. So out of that work came a number of themes that helped us develop some very specific resources. So really useful piece of work for us, but it made me realise that it's much more complicated than putting things into boxes, and actually people are much more complicated than saying it's one thing or another. And with every case we look at, we have to try and make sure that managers have got the skills and resources to tackle each one individually, which is why we have the stress risk assessments and we have all these other tools so we can do some bespoke support for people in those situations.
Okay,
Thanks,
Andrew. Thank you. Richard wants to come back in, then I'll come back to you, Dan. Thank you.
Thank you, Chairman. Ready to come back. May I make 2 points? First, I completely agree with Gordon that as a nation, and mine as a county council, we are more open about talking about what I'm going to call emotional well-being. And the fact that I use those words, and there are 3 terms here on the graph, I think shows, as Gordon has advised previously at these meetings, there's a level of genuine debate among professionals as to what the right term is and where things tip over from a bit of sort of mild worry about your job to what you could call depression. There's a debate there. And the fact we're using these different terms shows the degree of uncertainty we're all experiencing. A second point really picks up on Mr. Bedford's point and Mr. Champion's point. The hard-nosed, brutal question that might be asked by a council taxpayer is, why are you so much worse than the private sector is at attendance? That's the brutal question. It has to be faced, really. And it'd be good to be able to have a really good answer, which any of us, could give to an elector who put it to us quite bluntly. Mr. Champion makes the point that actually he knows of examples in the private sector where people have been simply got rid of because they, that was simple solution. Be interesting to develop a serious argument about what is really good practice, and arguably, are we as a county council pursuing the right good practice, as opposed to the employer you've referred to, who just says, get rid of him, get rid of her in some way or other. There's a real debate there, and it'd be good to give a serious answer to somebody who put that question fairly enough to us. Maybe we are actually taking the right approach and not just a bunch of, as somebody might say, in quotes, a bunch of softies.
Okay.
Mine's quite simple, really. You need to talk to Kent. They're obviously the leaders in this, because all we're doing is reading reports and you're saying this is what's happened. It's getting ahead of the curve now and saying, how can we alter things? 7.39 looks fantastic. What are they doing? Because today, tomorrow we could be Cumbria. Next year we could be Cumbria if we're not strategically looking at ways that are deemed correct, professional, equitable, but they work. 7.39. So to me, that would be an urgent call. Find out what's happening. Look at ourselves then with their evidence of how they behave and treat to be able to do something. And I think you couldn't do better than that, Gordon. Just find out from the winners where to go and how to do it. And it's as simple as that. Thank you.
Okay, thanks, Dan. Interesting to see how Newcastle compare as well, City, as a sort of comparator. But it is interesting. I mean, this report is statistical, so you made a suggestion about possibly bringing to this meeting, our offer to our staff and what we do offer with support, and you listed a few. And it might be quite interesting just a way of presenting that to us here, because I think as members we don't receive that support. We probably have access to it if we needed it, but we don't receive that as such as members. So it might be quite interesting if that happened. Gordon?
If we talked to Damien afterwards, we put something on the forward plan around a sort of wellbeing strategy and wellbeing offer. We'll have it as a separate report, but because it's not just about people who are off sick, but clearly it does link. yeah, we'll do something around that.
All right, thank you. I think there's been a good discussion there. So it's if there's nothing else, can I thank Andrea for her sort of input on that? As again, it's always a challenging sort of report because you're comparing, sort of data over the quarters. But I think there's been some good discussion, and we're asked to note the update provided on the council's overall position on the sickness absence as at the end of September 2022. So does everyone agree? Okay, thank you. Thank you, Andrea.
Thank you, Chair.
Item 10 is the Armed Forces Act, which is on pages 25 to 32. Zafar Salim, our Head of Communities Policy and Resilience, and also we're joined online by Sarah Carter, our Community Business Partner. So they're both going to present the report. Start with yourself, Zafar.
Yes, thank you, Chairman. This is a short report. It's primarily an update because Sarah brought a report to committee last May, and at the time there was some uncertainty about when the draft regulations would actually become an act of Parliament. So in anticipation of that, because we thought at the time it'd be something around September 2022, although obviously it's slightly later than November 22. So in anticipation of that, we looked at our existing work programs and work stream, because we clearly, Sarah and colleagues from departments together with the NHS and district colleagues and the city and Rutland have been working in this field for a number of years in terms of the Armed Forces Covenant, and what we did was integrate that work into the compliance requirements of the new duty under the legislation. So that's now become law, and as I said, in Appendix A, there's been a series of work programs or work streams since September last year to ensure we are compliant. And in simple terms, this will operate in a very similar way to equalities legislation. So we'll be under a statutory duty to demonstrate that we've had due regard to the specific needs of the armed forces community. We've amended our paperwork, policy, guidance, etc. There's information for our staff and service users and members on our intranet pages. We've looked at our monitoring arrangements through First Contact Plus and adult social care. We've also looked at school admissions policies. We've also worked with housing and homelessness colleagues in districts, but it always was a priority category within the legislation. And then finally, we've looked at our employment practices with Sarah and colleagues from the corporate centre in terms of our employment policies and strategies, and in particular around recruitment, retention, and their specific programmes of work and positive action measures specifically within environment and transport. Broadly, that's what. Sorry about this. I'm not really. I don't know why that happened. I'm not normally short of. Is it emotion? Oh my God! I don't want to get back into your stress management. Yeah. Just to reiterate, there's nothing soft about Gordon. He's a tough guy. He's from Scotland. I think he's got a world supply of iron brew. So in terms of where we're at the moment, the legislation covers 3 areas, which is housing, healthcare, and education. Although we anticipate next year there'll be additional guidance around adult social care and children's social care. So we expect this to be an ongoing issue. So in terms of where we are, I think in terms of statutory compliance, we're there. I think we're probably further ahead in terms of the covenant and our employee recognition, because we're still at gold status in terms of Ministry of Defence there, and we hope to retain that. So, and previously, as I said, we signed up to the Armed Forces Covenant. So in terms of that, if it's helpful, Sarah, do you want to add anything to that?
No, thank you, Zafar. I think I'll probably just add that around employment, we're continuing and strengthening our work with the Career Transition Partnership, and there's lots of work both in person and in our systems to make sure that we look at that employability and the transference of skills from ex-forces across to the authority and skills matching. So not necessarily in the Appendix A, but it's part of the wider Covenant programme that, as Zafar mentioned, trying to keep us ahead of that curve of not just complying, but going that extra step.
Okay, thank you, Sarah. It is interesting, the appendix, I think as Cabinet and I think as members, certainly Mrs Posnett, Mrs Richardson and Mrs Taylor are very passionate about this, and we get reports on a regular basis, and it is good to see. I mean, if members, I'm sure you did follow the link to the Armed Forces internet page and then the links onto the districts and boroughs as well. It's good to see that the coverage is there, and I think the work we're doing is excellent. But members, do you have any comments or questions? No? Okay, we're asked to note the possible implications of the new Armed Forces Act on the council as an employer, and I think that really comes down to our, the due regard to healthcare and education and housing, and I think that is covered in the report, and to note the progress that has been made towards the meeting and this obligation. So I'd just like to say, for me, it's a good report. It's a positive report as well. So keep up the good work. And it's interesting to get an insight as to Gordon's success with Earn Brew, and I think we need to start issuing that out on tap to all members and also staff as well. So thanks for that, Zafar. So does everyone agree with recommendation? Thank you. Thank you, Zafar. Thank you, Sarah.
Thank you very much.
Item 11, our final report, is the Organisational Change Policy and Procedure Action Plans 33 to 38 of your agenda packs. Damien Buckley, our Democratic Services Officer, is going to present the report. Damien.
Thank you, Chair. This is the report that comes to each committee, and it presents an update of the current action plans which contain provision for compulsory redundancy and details of progress against their implementation. And there's two appendices, one that outlines action plans which are completed and one that outlines action plans which are underway. And members are just asked to note the report and the action plans.
Okay, thanks, Damien. No comments or no? Okay, thank you. So we'll note those plans and the current action plan, which contains provision for compulsory redundancy and details of progress in their implementation. So yeah, very short appendices. So thank you for that. Item 12 was mentioned earlier. We don't have any urgent items brought to today's meeting, and item 13 was just for the date of the next meeting, which is 25th of May at 10 a.m. So can I thank all members and officers for their attendance and input today, and I'll now close the meeting. Thank you.